Okay, so what is IAPT? So IAPT is a psychological service. It stands for Improving Access to Psychological Therapies. And this is a program that started under an NHS initiative in 2008. The main aim of that back then was to help to reduce unemployment rates amongst adults. And we also provide evidence-based treatments for people with depression and anxiety disorders, and also comorbid long-term health conditions. So the IAPT services are basically characterized by three main principles. The first being that is evidence-based psychological therapies at the appropriate dose. So this is basically where NICE recommended therapies are matched to the mental health problem, and that the intensity and duration of the delivery of that intervention is made to optimize the patient's outcome. The second part is for it to be appropriately trained and a supervised workforce. So this is basically us providing high quality care provided by clinicians who are trained to a certain level of competence and are accredited in the specific therapies that they are delivering. So these clinicians will also receive weekly outcome-focused supervision by senior practitioners who can support their clinical development. And the third bit being routine outcome monitoring. So this is basically the use of specific standardized questionnaires each session so that progress of the patient can be tracked. This can help to guide the course of treatment. It can also help to give resources for us as a service to see where we need to improve, and also offers transparency, which is always really important. So IAPT services use a stepped care model, and this always starts at sort of the low intensity CBT interventions for those with mild to moderate depression or anxiety disorders delivered by psychological wellbeing practitioners. So this is at step 2. These could be through one-to-one sessions in what we call guided self-help using the CBT framework. We could also offer this through computerized cognitive behavioral therapy, where there's a program that patients can use, which is a bit more flexible. But we also offer therapy through groups and workshops as well. So following sort of low intensity work, individuals can be stepped up to a high intensity intervention, which is delivered by high intensity therapists, which is step 3. So this is where if patients don't fully recover at low intensity, they may be stepped up to this level. If they have more severe depression or social anxiety disorders or post-traumatic stress disorders. And examples of interventions at this level may be through IPT, which stands for interpersonal psychotherapy, and they might do sort of brief psychodynamic therapy here, or behaviorals couples therapy or counselling here at this level as well. So overall, the stepped care model works under the principle that people should be offered the least intrusive intervention appropriate for their needs first, and that sort of follows the NICE guideline recommendations. I'll be passing over to my colleague, Danielle.
So thinking about why we believe in a diverse workforce, so firstly, we recognise that institutional racism exists across the healthcare systems in the UK, meaning that we know that outcomes for particular ethnic groups, there are a few kind of disparities within kind of outcomes and how many people from a particular ethnic group may kind of access some of the IAPT services that we work in. And so we firstly believe that a diverse workforce is one of the ways to actually address some of these disparities. And I suppose thinking about the field of psychology, it's often been a field that tends to be kind of white middle class professions. And we know that London is a diverse and multicultural city, which means that the people who are accessing our services tend to also be from diverse ethnic backgrounds. So it's really, really important that our staff clinical group also represent the sort of populations that we serve as well. And having that diverse workforce and people from different backgrounds also then brings about the opportunity for us to kind of to bring about our background and our experiences into the services that we work in, which means we can then share this within the team and think carefully about how we may make kind of adaptations to treatment and think about particular issues that affect different ethnic groups that we may see within the community. So it's really important that our IAPT services have a diverse workforce, which is one of the reasons that prompted us to make the video for the incoming intake. So just to tell you now a little bit about kind of my route into psychology. So I studied psychology firstly at GCSE level and at A level, and went on to study psychology at university. So it was a BPS accredited course, which is really important if you're wanting to pursue a field in psychology. I also did a bit of work experience at Rethink Mental Illness charity, where I worked specifically kind of in research. And I also offered emotional support at another charity at Mind, which was mainly kind of offering patients listening support. I then did a master, and part of that, I was offered a placement as part of that degree, where I then worked for IAPT, which is the Camden and Islington IAPT service. And I did a 3-month placement there. And then I applied for PWP training, became a qualified PWP, and now I'm working as a senior PWP for IAPT. So I've followed quite a traditional route into psychology, but some of my colleagues who will now start to introduce themselves, you'll see that you don't have to follow this particular route if you're wanting to pursue PWP training.
Hi, so I'm Zoe, and just like Danielle was saying, there are very different ways that people get in. So for me, for example, I started psychology at A level and was really interested in it, but I didn't pursue it in terms of my degree. It was actually very unrelated. It's in international politics. And then after university, I started working as a teaching assistant in a mainstream school, but I was working with children with like a range of special needs. And after a while, I became a bit interested in counselling. I wasn't really thinking of it in terms of a career, but I was just really interested in, I guess, communication. And so I did a couple of those courses that I mentioned there. And then after a while, I started to think, oh, actually, maybe I want to get into this more as a career in terms of supporting people through like talking therapy. So I heard about the PWP role, applied for it, wasn't successful the first time, and I think I'm not the only person, but then did it. I think I applied to Middlesex to do the trainee graduate mental health worker, which is a little bit of a different role, but also gives really useful clinical experience. And as I started that course, I kind of applied for that one and the PWP one a second time around the same time. So after I started the Middlesex course, I then realised that I'd gotten onto the PWP course. So I was only there for a really short time at Middlesex and then started the course. And yeah, so I finished the PWP course in 2019. So it's 1 year training. And then I would just worked as a qualified PWP for a year. And then since last year, I've been working as a senior with Danielle. Yeah, it's been an interesting, different route in.
So my name is Celine. I did not do anything psychology related until after my undergraduate degree. Similar to Zoe, I did it in international relations and development studies. Soon after that, I graduated and was like, who wants to work in charities? Not me. So I started working in a school with kids that had social emotional needs, and then this kind of prompted me my interest in psychology. So I then completed a conversion master's degree. So the idea is if you want to practice psychology specifically in the long term, you would need to then do a conversion degree, and it has to also be BPS accredited. So that's what I did, and during that time I gained some work experience in acute mental health wards, later on early intervention for psychosis. I worked abroad with Save the Children with Syrian refugees, and then came back and completed my PWP training at UCL. I didn't stay where I trained. I went on to be a locum. So locum is essentially short-term contracts. You go from place to place. And I did that to just gain experience of how different IAPTs work, how different populations are. And now I'm currently a PWP in IAPT.
Hi everyone, my name is Charles. So quite similar to what you've already noticed, that there were different routes into the PWP life. So I really didn't study psychology until my undergrad degree, which I know is kind of sacrilegious. So I actually had an interest from it from my A levels, and I was just from my biology route, being quite interested in the brain and also how mental health develops as well. And so what I thought was quite useful was for me to gain some experience of working with people with mental health problems. So I actually volunteered at a forensic rehousing project, and that was quite useful. I was gaining first-hand experience people of working with people with different psychological issues like psychosis and schizophrenia. So I'm quite similar to my colleagues. I also completed an undergraduate degree in psychology, and I was also BPS accredited. And then after my degree, I also gained further experience working in an inpatient acute mental health ward. So I worked in a eating disorder ward and also a psychosis ward as well. And that was really quite helpful to gain different experiences in terms of how you can treat people holistically as well. So from that, I also then completed a degree in psychological interventions and therapies. So that was my master's degree, and that was further allowing me to develop my clinical skills as I was gifted with a placement opportunity, and that allowed me to work with Mind Mental Health Charity to offer mental health support and emotional support for clients with mental health problems. So from that, then I completed a PWP training at UCL, and then later became qualified almost a year ago as well.
All right, great. Thanks, Charles. So I'm Amar. I'm also PWP here. So I studied psychology at A levels. It was the first time I actually heard of psychology, so it was quite a while ago when I did that. And then I went on to volunteer at Mind as a befriender whilst doing my undergraduate degree in psychology at Goldsmiths. Shortly after I graduated, I worked in various different roles. I worked as a teaching assistant at a SEN school for a period of time. I was also kind of volunteering at Samaritans as a listening volunteer, kind of on the weekends. About a year later, I kind of did my master's in foundations in clinical psychology and mental health services, also at Goldsmiths University. After completing my master's, I went on to do about a 9-month honorary assistant psychology post at the Maudsley, where I worked with older adults inpatient ward. Wasn't my first choice, but I actually learned a lot, and I actually was quite surprised of like how the different disorders kind of presented in older adults. So that was quite a insightful experience for me. I then went on to work at Wandsworth IAPT, where I was a wellbeing practitioner. What that meant was basically working with various community groups, from kind of mosques to schools to other religious kind of places, as well as kind of working with people in armies and stuff like that. There's various different kind of groups. Kind of do some community outreach with those local organisations, trying to kind of improve access into IAPT, which is what IAPT stands for. And then I went on to apply for the training at UCL, where I got a place with the Camden service. And then I qualified about almost a year ago now, and I'm working here as a qualified PWP.
Okay, thank you, Amal. So my name is Tolu. I basically started psychology at A-level route. So I studied it for A-level and then went on to complete it on my undergraduate degree, which was also BPS accredited. On my course, we basically had the option of doing a placement year, which I took up as an honorary assistant neuropsychologist at the local hospital. So this was predominantly working within sort of acute stroke unit. So I'll go on sort of units and do assessments on patients, work as part of the MDT with the occupational therapist and physiotherapist as well as doing sort of outpatient work as well, people with different head injuries. After that, I worked as a rehab support worker when I graduated. So this was in a brain injury rehabilitation trust for about 6 months, where I was doing loads of different activities with the patients. I also did a lot of shadowing with the clinical psychologists in the service, assisting patients with their volunteering and working with different teams again. And then I went on and got into the training for PWP training at UCL and became qualified and still working here at IAPT.
Great, so that's kind of all of our roles in routes into the PWP role. So I'm just going to, I guess, myth bust a few kind of popular kind of, I guess, things and beliefs that people have out there. So the first one being that you don't need to get a first in your undergraduate degree. You also don't necessarily need a psychology undergraduate degree, which you probably saw from a few of my colleagues who spoke earlier who didn't have any sort of psychology undergrad. Another common belief is that you must have several years of relevant clinical experience. Again, that's not necessarily true. As long as you have maybe some experience and kind of can show how various different roles that you've done can actually apply to the role, that's the main thing. Another myth is that you must have experience as an AP. Again, I don't think many of us did, if at all any, have actual like kind of paid AP roles. And the next come on is like it's very competitive or hard. Again, that's not necessarily true. As you saw, like we kind of all came through kind of after doing various different things. And the last one is that you won't have many career options if you do the PWP role, which my colleague's actually going to tell you a little bit about. Actually, that isn't true, and to tell you about what roles there are in IAPT.
So I guess we are kind of focusing on the PWP role, like in this webinar, but there are so many different roles within IAPT, within IAPT. So we've got what we do as PWPs or psychological wellbeing practitioners. I'll give a bit more insight into what that looks like on a day-to-day basis later in the presentation. But yeah, the other clinical roles, for example, being a high-intensity therapist, which Tolly spoke about earlier, or a clinical psychologist. So within the kind of clinical team, in terms of the offering support and treatment to people, they're the different kind of roles that we've got there. And then we've got admin roles. We've got our placement students who provide a very useful part of the service in terms of helping us to do our jobs. And yeah, there's just quite a range of different things that people do. And what that means as well is that as a PWP, if you want to develop in your career or do something else, you can go a managerial route, like being a senior PWP, which is what I'm doing, or the other routes to develop clinically, as I said, to do a high intensity course and other things like that. So it's quite it's a very dynamic service, and there's a lot of kind of different directions to go in. I think we'll speak a bit more about kind of what helps to kind of get onto the course and things like that. So I'll just pass on to Selin, who's going to take it.
Thank you, Zoe. So how you apply to become a PWP. So at the time of us recording this, applications have now opened for UCL specifically. So Camden is a inner London, sort of north central London service. So we're primarily kind of basing this on what we know of UCL. So it runs 2 cohorts per year for a September-October start. Applications are now open, so May, and it closes within sort of less than 2 weeks. I think it's closing on the 17th of May. And then for a February-March start, applications open October, November. And again, quite a short time to submit applications. A lot of questions around, does it have to be through the NHS jobs? For UCL, no. It must be completed through the university itself. And in your application statement, you highlight the 2 preferred boroughs that you would like to train in. And again, the boroughs, the list of those boroughs are on the UCL kind of recruitment pack. So you would say, I want to be preferred for Camden or Haringey or Harrow, etc. Another option available close to London would be the Exeter University. They also do PWP, but the idea is universities and services across England essentially offer the PWP training. So even though we're focusing in London, every kind of city, borough, etc. should have an IAPT and therefore have a training program to go along with it. around kind of, you know, seeking further support in your application, there are quite a few Facebook groups for PWPs, aspiring PWPs, around applying for training, and it can be quite a good support network for those interested in applying, finding out more information, you know, asking if people wanted to read through your application and kind of give you feedback. You can kind of find quite a good support network on those groups, which we will try to link along with this video. So now my colleague Zoe will talk about the key skills you need to show in your application and personal statement.
Yeah, so we'll go for like the personal statement and then towards kind of interview. And I think the first point there really highlights something that really makes a difference. So thinking about and making clear what you've learned from your experiences rather than just kind of describing what you did. And actually think in my case, you know, I said I applied for the PWP course twice. I didn't actually have any different experience in between that time. I was still working as a teaching assistant, but I think in my second application, I kind of demonstrated more what I'd learnt. So I think that's a really important skill in a personal statement and application. So for example would be if you have a customer facing role where you might kind of work in sales and speak to customers, instead of kind of just listing that, really speaking about any transferable skills you might have gotten from that. So for example, learning to listen to people and how you might demonstrate that, and knowing that that's important to the PWP role. So really kind of linking what you know about the role and trying to connect it with your experience. So some of those other points that are on here cover that as well. I think it's really important as well to acknowledge that this is a training course, so there's going to be room to develop. There are going to be things that you don't know, and that's fine. It's not going to put you at a disadvantage to say, actually, I'm willing to learn this. That actually is seen as a strength in an application. So that's really important to kind of bear in mind. I suppose with all, you know, applications, it's really important to just make sure you double check grammar and spelling. I know sometimes we can be so focused on the content that we forget to do things like that. But again, that really does make a difference in terms of how the person reading it, how it kind of comes across. And I would say it's easy to kind of focus on the clinical element as well. And actually, it's helpful in the application to speak about or to acknowledge that, you know, it's going to be an academic course. And so like Selin was saying, is at UCL, that's going to be a lot of, you know, learning and reading and things like that. So it's really important that you demonstrate your ability to kind of study at postgraduate level. And that's something that helps the reader to kind of pick up your knowledge of the PWP role. I think most of the other things, you know, character limit as well, that's also really important. Sometimes people's applications actually cut off and they don't notice because they've exceeded the limit, but they've copied and pasted. So all those little things you just want to really be clear on. And I guess lastly, which we kind of said throughout, is really tailoring the application. So actually having a look, there's going to be a link like at the end of the slides, but having a look at like the PWP, the job description, the person specification, and really kind of trying to like make direct links between the specification and what you can offer, what your experience has taught you. So that's what I'd say for the kind of application, the written side. And I guess in terms of the interview itself, as usual with all interviews, you want to arrive on time, dress professionally. Who knows, it might be online or we might be going back to face, but either way, it's really important to kind of keep up that presentation and that kind of, you know, wanting to, what's that phrase about? You don't get a second chance at a first impression. I think that's it. But yeah, so that's always really important for all interviews. And in the beginning, you would be kind of given instructions about the interview timings and what's expected, etc. If you're not clear on any of those, it's absolutely fine to just ask to clarify either then and there or later, or if you would like a question to be repeated. All of that is perfectly fine. We don't want you to feel kind of thrown off by that, because the interviews are there interviewers are there wanted to kind of get the best out of you rather than kind of throw you off. So if you don't understand something or need something clarified, do kind of make that clear. Again, to be kind of specific rather than descriptive. So for example, instead of saying, listening skills, like I think I have really good listening skills. We do want to be really specific. So when people are speaking, I know to keep eye contact or to nod and to have like non-verbal communication. That's a lot clearer than kind of speaking generally. And that's something that interviewers do notice. As I said earlier, like because the interviewers are wanting to get the best out of you, they might interrupt you or they might prompt you and say, oh, can you say more about that? That's not evidence that you said anything wrong necessarily. It's just, again, it's wanting to give you as much opportunity to kind of bring your best to the interview. And I would say something that you could actually do from now maybe is to make a note of what we call like case examples or clinical case examples. So again, this might not always be like a clinical situation. It could be working with a student as a teaching assistant or any of the other diverse experiences you have, but it's really used to have specific examples of when you have worked with somebody and helped them to develop to work towards their own goals, when you've had to demonstrate communication, when you've had a difficult situation that you've had to resolve. These are all the key things that even now it's important to kind of make a note of your kind of experiences, so that when it comes to the interview, you're not kind of thinking on the spot. You've got 2 or 3 cases that you thought through and kind of feel familiar with. And yeah, I guess I spoke about the non-verbal communication in terms of explaining that you can, or demonstrating that you can, that you're aware that that's important. And of course, that's one way you demonstrate that is not just by talking about it, but actually in the interview, is actually just being present, really. Again, that's through non-verbal communication, eye contact, smiling, nodding, those kind of things that just just give a sense that you're present in the interview. And we do want you to bring yourself to the interview. So of course, it's they're looking at skills and what you're bringing to what you're thinking through in terms of how you might meet the role, but we'd also be interested to meet you. So don't be kind of too shy to bring yourself to the interview. And I think similar to what we said in the last slide, to think about like owning what you do know. So it says owning what you do know and acknowledging that you're there to learn. And I think what that means is just being really aware of your strengths and saying them for what they are. So if you know that you have strong communication skills, feel free to say that and demonstrate it, as I said, being specific, but at the same time acknowledging that there are things that you don't know and that you're willing to develop and you're willing to learn and you're expecting to learn. And these are kind of like reflective skills that are going to be very useful on the course. And so we look out for that when we're doing interviews. Yes, I think Charles is just going to go through like a day in the life of a PWP.
Great, thanks, Zoe. So I thought it was quite helpful to give you an insight to what a typical day as a PWP looks like as well. So usually we start our day at 9 o'clock. So for me, I get to the main base in Camden. So that was kind of pre-COVID life, and all the PWPs work from one of our 2 local bases. So that would be either north or south, depending on where you are located. So in our case, it would be either Camden or Islington. So usually I always start my day with a cup of coffee, and then I would check my emails and get caught up with a few admin tasks from the day before as well. So it's really useful just to ease yourself into the work schedule. So at 9:30, that's when I have my first appointment, and that's usually from a GP or self-referral that has been reviewed and seemed appropriate for us to have an initial telephone screening. So the telephone screening is initially lasting for about 45 minutes, and the aim of really is to gain an insight to the overview of the client's difficulties and to ascertain what would be the most appropriate treatment for the client as well. So from that, this may be taking the service user on for treatment or either signposting to another service as well. So following that, I would typically allow myself to have a 30-minute admin time. So this allows me to write up my notes from my initial telephone screening and also my notes from previous appointments as well. So I typically have lunch around 12, and that's usually a 30-minute break. And during that time, I spend time chatting with my colleagues. So I'm someone who's quite lucky to work with some great people, and it's important to take that time out and to have that break, because from the work that you would be doing, it can be emotionally draining as well. So at 2 o'clock, that's usually where I have a face-to-face treatment for clients. So usually for treatment, we have a block of clinical time where we would schedule in our treatment appointments to have consecutive treatment sessions throughout that time period as well. So it would really depend on which service you go to and also the clinic space that you are given. But there is some flexibility in diary management as well. And I also have telephone treatment with clients, and that's usually as we see people face to face. We are also skilled in delivering treatment through a range of alternative delivery systems. So that can be through telephone or web-based support as well. So telephone delivery can be the main contact in also some services. So I think it's quite helpful to just note that as well. So one part of being a PWP is receiving weekly supervision, and that's to help you manage your caseload and support you clinically to decide which stepped care treatment is appropriate for newly received clients as well. And so usually when I have supervision, that's typically with a high intensity therapist or a clinical psychologist as well. So when I get to the end of my day, which is usually around 4:30, that's the time for me to write my last notes and also to respond to any messages or emails before I close the day. So on a typical Friday, I always go for a run, which helps me to relax for the weekend. As I've mentioned, this work can be emotionally draining, so self-care is really essential to be able to manage this as well. And I also think it's important to remind ourselves why we do this work. So I'm someone who feels really quite lucky to have such a varied job and the opportunity to work in such a great team that really helps to motivate me and allows me to produce my best work as well. So now I'm just going to hand it over to my colleague Zoe to explore further resources as well.
Thank you, Matt. You meant Celine. It's okay, Charles. Thank you for saying we're such a nice team. So further resources, essentially, we want to link, obviously besides UCL's link for the low intensity program, there's some more information available on prospects, ac.uk, and also an NHS link as well that's quite new that I'm going to hopefully add along with this video, because I'm aware that you can't click on these links. So hopefully we will provide a few more resources for you to find out a bit more, as well as those Facebook groups that we mentioned. But I hope that this has been helpful for you, for whoever's watching. As we said kind of at the beginning, it's really important that we kind of give equal access to those who are from marginalised backgrounds, and I hope that this has given you a bit more insight into what IAPT is, how to get onto the course, and the type of skills to have in the back of your mind when you're applying, and we hope that you're successful on getting on.